Hi, I am Dr. Ramakrishna Chowdhary, consultant neurosurgeon at Arete Hospitals, Gachibowli. So today we are talking about meningiomas. Meningiomas are one of the most commonest tumors of the brain. They arise from the dural coverings surrounding the brain. To be precise, they are called as meninges, which are the coverings around the brain. And this tumor specifically arises from something called as arachnoid capsules, which are part of the covering. Most of the meningiomas are slow growing tumors. They are usually benign tumors. Less than 1% are aggressive or malignant tumors. So coming to the etiology of meningiomas, like any other brain tumors, they also have association with trauma or radiation exposure. For example, patient has been received radiation for some other pathology, then chance of having a meningioma in the future is little high compared to the normal population. Apart from this, the family history. For example, patients who have something called as abnormality NF gene, neurofibromatosis type 2 gene, the chance of having meningiomas is quite higher compared to the normal population. Coming to the usage of phone leading to meningiomas is not proven. So there is no much association of brain tumors developing due to excessive usage of the mobile phones. As the whole of the brain is covered by protective layer called as meninges, which covers whole of the brain including the skull base, the all around upper part of the brain. As the meningiomas are very slow growing tumors, it takes quite a long time for the patient to present with symptoms. Maybe few years for the first symptom to develop. Depending upon the location of the meningioma, the tumor is very near to the motor area, that is the area of the brain which helps in the movements of the hand, leg or facial movements. If the tumor is increasing over size and pressing onto this area, patient can have weakness in the hand or leg, or most common symptom would be headache. As the tumor increases in size, this increases in pressure within the skull cavity and leading to the headache. Other symptoms could be present with seizures, because as the tumor increases, it's going to irritate the surrounding brain leading to a fit. Depending upon the location again, if the tumor is in and around the optic nerve, visual pathway, the patient can have visual symptoms. If the tumor is very much near to the 7th, 8th nerve, then they can have hearing disturbances. Or as the meninges cover not only the brain, they also covers the spinal cord. So the population can have tumors that is called meningiomas either in the skull cavity or in the even spinal cord. So depending upon the location again, if the tumor is in and around the spinal cord, then as the tumor increases can compress the spinal cord leading to weakness in the hand, urine disturbances or swaying or difficulty in walking. So once the patient comes with any of the symptoms like headache, seizure or weakness in the hand or leg, progressive weakness or difficulty in walking, so could be a lesion in the brain. So we always get a CT or MRI done to look into pathology what's existing within the brain leading to these symptoms. Unlike other tumors in the brain like gliomas or the ependiomas, where histological diagnosis cannot be made or cannot be confirmed only with imaging, but in case of meningiomas they have a clear cut picture and MRI 99% of time says that this is a meningioma.